Welcome to Wednesday's edition of COVID-19. Authorities have recorded a second day of daily infections hovering below 1,000 here in Korea, where preparations are also underway to start vaccinations next month. Now, we have more on these plans with our panel of experts later on in the program. Here first is our Kwon So-ah with the broader pandemic coverage. So please start us off with the situation here in Korea for this Wednesday.
Sure, Sunny. Well, the number has actually risen compared to yesterday, but as you just said, we are below 1,000. 840 infections were reported this Wednesday, with a little over 800 domestic infections. And that's raised the total caseload here in the nation to 65,818. The death toll stands at 1,027, with 20 fatalities added in the past day. And out of the 17,796 people currently in quarantine, 411 are said to be in severe or critical condition, and that number is gradually rising despite the actual drop in infections. And if we take a look at this graph now, it is good to see that we're seeing triple digits have outnumbered four-digit figures in this Tuesday to Tuesday span. But the recent drops but we are still seeing ups and downs, so it is not a clear sign of a decline right now, but we have been also seeing numbers above 100 for the past 60 days.
Right. Now, so I understand the government has cautiously claimed some improvement in the COVID-19 situation here.
Right, Sunny. And also, given that some 100,000 COVID-19 tests are being carried out every day on work days, with yesterday being no exception, that can actually be translated into an actual drop of infections, which have also brought the weekly average down, standing at 863.7. And when it comes to the number of domestic cases in the past week, that average stands at 833.6. So given this development, the health ministry had an evaluation on this current situation. So let's take a listen.
We believe the country's latest outbreak is past its peak and now in a phase of gradual decline. But considering that the virus is spread across the nation, we expect the number of cases to drop at a slow rate.
As Yoon just said, the cases are spread across the country, with today not being an exception. Gyeonggi-do province reported the highest figure of 284 cases, followed by 264 in the capital, Seoul. And cases were linked to medical facilities, religious facilities and gatherings, as well as a detention center here in the capital, Seoul. Our Kim Han-ul will have the details on that outbreak after this segment. But first, let's take a look at the global figures. We now have 8 countries across the world that have over 2 million infections, and including the rises in many countries, there is also more concern of the variant spreading to many places of the world. As the World Health Organization says, 41 countries now have been affected by the variant. And speaking of which, we have here the UK with a record high of 60,916 infections recorded in just a day. And also South Africa is seeing resurgences with 14,410 infections. And now there are researches being carried out whether the vaccines for COVID-19 actually work on the variant. And the global number now stands at 86.8 million in total. And those are the updates I have for now. I'll be back with more tomorrow. Sunny?
All right, So thank you for that. We'll see you tomorrow. Right, back on the local front, as our So just mentioned, officials have disclosed the results of their 6th round of extensive testings at a correctional center here in Seoul. I have our Kim Han-ul here in the studio with details on that and more. Welcome, Han-ul.
Good afternoon.
Now, do start us off with the results of those tests, Han-ul.
Sure. So the 6th round of mass testing on all inmates at Dongbu Detention Center in Seoul has been completed, and there's been 66 more cases being added, making the total to 1,191 at all correctional facilities nationwide. Dongbu Detention Center is ground zero for one of Korea's worst ever mass outbreaks after confirming its first index case over a month ago. This is now the biggest cluster linked to a single facility that the country has reported since the pandemic began. On Tuesday, Prime Minister Chung Se-kyun admitted that the government may have been slow off the mark in responding to the outbreak and ordered tougher measures to be implemented at correctional facilities nationwide.
We must now respond quickly to the outbreak at Dongbu Detention Center, having already missed the opportunity to contain the virus in the early stages. I urge the Ministry of Justice to work closely with health authorities and enforce more stringent distancing rules at correctional facilities nationwide.
Senior health official Yoon Tae-ho announced today that nearly 1,000 prisoners from Dongbu Detention Center have been transferred to other correctional centers, lowering the inmate population to 64% of its total capacity. He said those tested positive have been moved to designated medical centers for treatment. Nationwide testing will be conducted in all correctional facilities in Korea, and each inmate will be provided with 1 mask a day.
Right, Hannah. Now, in recent days, there's also been much dispute over the fairness of the government's COVID-19 restrictions on businesses. Tell us more.
Sure. So there's an increasing number of gym owners in Korea who has been protesting against the current social distancing guidelines, citing that there's a clear loophole in the current framework. According to the Gym Owners Association, around 300 gyms in the nation reopened this week as an act of defiance against the current social distancing guidelines. Indoor fitness centers have been ordered to close under level 2.5 distancing rules, which have been extended until January 17th. However, taekwondo and ballet classes have been allowed to reopen under certain conditions, which gym owners say is unfair. They say the impact on their business has been especially hard, with January being the peak season for new gym memberships. Meanwhile, the National Union of Coffee Shop Owners plan to stage a rally tomorrow in front of the Sejong government complex. They are urging the government to revise its measures, allowing cafes to only accept takeouts or delivery orders compared to restaurants, which are allowed to have people dining in.
I see. Meanwhile, the government is also seeking, yet again, that is, to ease the financial burden on families amid the pandemic. Hannah, tell us more.
Yes, so during his first cabinet meeting of the year, President Moon Jae-in vowed to help restore a sense of normality to the lives of the Korean people. Take a listen.
올해 대한민국의 최우선 과제는 코로나의 긴 터널에서 하루속히 벗어나는 것입니다. 정부는 3차 재난지원금을 다음 주부터 지급하는 등 어려움을 덜어드리기 위해 최선을 다하고 있습니다.
The third round of emergency financial assistance is expected to help around 6.5 million people whose livelihoods have been affected by the COVID-19 pandemic. This includes small business owners, taxi drivers, freelancers, and people with temporary jobs. Starting from today, the Ministry of Labor will accept online applications until the 11th and at local job centers starting from Friday. Each person is eligible to receive 500,000 won or around $460.
Right, that's good to know. Now, Hannah, before you go, one last question, that is, I hear a growing number of consumers are going online.
Right. According to a report released by Statistics Korea yesterday, online and mobile shopping transactions in Korea has reached an all-time high in November last year. Online shopping amounted to 15.06 trillion won, or roughly $14 billion in November, a 17.2% increase compared to the same period last year. The surge in demand was especially notable in food delivery services, with sales jumping 60.6% on year. Mobile shopping with the use of smartphones was seen at an all-time high in November as well, with sales totaling 10.2 trillion won, or roughly $9.4 billion. The growth in online shopping is being attributed to the fading popularity of brick-and-mortar stores following a resurgence of COVID-19 outbreak in Korea.
Okay, Hannah, thank you for that coverage. I hope to see you again soon.
Thanks for having me.
Right, staying on the local front, a research team has come up with a technology that seeks to eradicate the coronavirus and fine dust from the air. I have Jessica Lee up next. Hello, Jessica.
Hi, Sunny.
So where is this research team based, Jessica?
So I'm reporting live from Hwasong City in Gyeonggi-do Province, and it is well known that higher levels of fine dust cause more risks of infection of the influenza virus. Moreover, a recent study shows that there is an especially strong effect on COVID-19 as well when fine dust gets worse. This is because the coronavirus adheres to fine dust, and this increases its possibility of infection. And that's why we need to be extra careful about COVID-19 infection when fine dust level is severe, such as during the winter season. And unfortunately, with the third wave of COVID-19 still gripping the nation, concerns are rising every day. However, we do definitely have some great news amid this pandemic. So one of the technologies we developed to live a better and safer life coping with this current situation is this smart shelter that you see behind me. This is a new technology developed by domestic researchers, which is designed to combat both the novel coronavirus and fine dust as well. So why don't we go inside and find out more about this smart shelter? So I will now get inside of this smart shelter, and now I'm standing in at the entrance. So as you can see here, there is a footprint at the entrance, and I'm standing here, and this thermal imaging camera is checking my temperature. And AI, artificial intelligence technology, recognized me and blows off fine dust that's attached to my body with the wind. And as you can see inside here, UV sterilizers all installed to remove fine dust and viruses. And of course, inside air inside is also purified and then flows out. So let's take a look at this filter here. So this filter right here can remove both fine dust and the dramas that can possibly contain viruses. And of course, you can also check out this UV sterilizer here as well. And how effective is this sterilizer and this smart shelter? Korea Disease Control and Prevention Agency found that the smart shelter can block about 99% of coronavirus in 2 to 10 seconds. So as you can see here, I did try myself this smart shelter, and now we would like to have a talk with an expert. So good afternoon.
Good afternoon.
This is Dr. Park Dok-shin, who's joining our show. Thank you for your time today. So I did try this smart shelter myself, and I do have a question that can you please share about the reason of inventing this smart shelter?
Controlling viruses and particles matters are main issue on front of big building. We can control both of them in a few seconds using smart shelter.
Oh, thank you. And my next question is that where will the smart shelter with smart and safe technologies be installed and used in the future?
We can apply this system to multi-purpose facilities such as subway stations, hospitals, shopping malls, and government buildings.
Thank you so much for your answer and time. So we do hear some hopeful and bright news this day through the effort of our domestic researchers. While we do have some innovative solutions and technologies are being carried out, this is the right moment that everyone, including healthcare workers, researchers, and of course all of us, to take extra precautionary measures and follow personal hygiene guidelines to stem the further spread of this infectious disease. And once again, please abide by the social distancing measures and stay safe and healthy. So this has been Jessica Lee reporting live from Hwasong City. And back to you, Sunny in the studio.
All right, Jessica, thank you very much for that coverage.
다음 달부터는 백신과 치료제를 통해 보다 공격적인 대응이 가능할 것입니다.
It's a really positive change for the country as a whole, and indeed for the world, that you can wait until 12 weeks to get the second dose.
For Moderna, 28 days later, and for Pfizer, 21 days later. That's what the data tells us is the best way to do it.
Vaccines against COVID-19 have been rolled out. Some countries have launched their inoculation campaigns and others are poised to follow suit, while many more have yet to secure their doses. Today we discuss the prevention and treatment efforts against the pandemic. I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you.
And I also have Dr. Kim Sing-taek from Institute Pasteur Korea. Good to see you again, Dr. Kim.
Good afternoon.
And joining our talk virtually is Professor Kang Chil-yong from the University of Western Ontario. Pleasure to have you with us, Professor Kang.
Thank you for inviting me.
Professor Kim, we'll start with you. Authorities have believed, that is, as our Kwon-seo mentioned earlier, the daily tally is on a decline. Do you share this thought?
I hope so, and it's encouraging the number is decreasing, but it's too early to say it definitely. The R number is now about 0.93, which is very good, but we have to remember what price we paid, and we heard that yesterday we had 840 patients, but what are they composed of? Are they composed of young, healthy persons, or are they composed of elderly and patients belonging to a high-risk group? I think the mortality rate is still high, so we have to wait until all the parameters improving. And as we know, it's been quite a long time since we had the high numbers of outbreak, and the manpowers, we put many manpowers in it, but still it's lacking, so they're getting fatigued. So I hope that this situation will improve better quickly.
Right. Professor Kang, given the plight faced by the globe at this particular point in the pandemic, what do you believe needs to take priority, vaccines or treatments, Professor Kang?
Certainly the vaccine should be the highest priority. For the infectious diseases, prevention is better than treatment. So we can have a much better impact with effective vaccines.
I see. Dr. Kim, what are your thoughts with regard to priority? Does it lie with vaccines or treatments?
Well, actually, I agree with the Dr. Kang's opinion, and then the vaccine is very important. And in the history, actually, some eradication of some specific infectious disease was actually demonstrated for for example, like smallpox. That was actually achieved by the vaccine development. So vaccine development is very important, but I would just compare the probably drug to a sword, and then vaccine as a shield. But the actual vaccination is not in real world. It's not really just 100% efficient. I mean, there are some movements like an anti-vaccination movement. So in this case, we need some treatment as well. And then the vaccine is not, well, currently the development by the Moderna and the Pfizer, well, the efficacy is really good, I mean, more than 90%. But then, which means also still just less than 10% of people are still just vulnerable to the infection. For those patients, where we need some drug development and then treatment as well.
The efficacy of the flu shot is only 60%. Is that right?
Oh, I think depending on the vaccine, but Moderna and then the Pfizer is 94 or 95%.
Which is why you say it's
very
quite high.
Good. Very, very high. But for AstraZeneca, depending on the schedules and then those, probably between the 60 to maybe the 70%, but that might change. So still, what I'm saying is still just 30 or 40% of people are still vulnerable even after vaccination.
Right.
Mm-hmm.
Professor Kang, reports of the new variants of the coronavirus coincided with those of vaccinations in the UK, US and Canada. Now, questions are being raised about the efficacy of these vaccines against the fresh strains of the virus. How do you respond?
Well, the changes that we see in the new variants is very small. The total number of amino acids is a chain of the amino acids, is a protein. It's 1,273 amino acids. There are only 2 amino acid changes out of that. And especially in the receptor binding domain, we know as RBD, has 222 amino acids. There's a single amino acid change. So even if there is a variance, of course, but the efficacy of the vaccine should not change, because when we look at the site where our immune system recognizes as epitope to make antibodies is normally about 8 to 15 amino acids long. And if you change a single amino acid, it should not affect much. And also, there are more than one epitopes in RBD. And so our vaccine so far should work in all those variants.
I see. That is quite encouraging to know, Professor Kang. Meanwhile,
Yes.
Professor Kim, there have been at least 4 cases of fatalities following Pfizer's vaccines in Israel. Now, 3 of them have been ruled unrelated to the vaccines, while investigation is underway concerning a 4th fatality of an 88-year-old man who had pre-existing conditions. A similar investigation is also taking place in Portugal amid the death of a 41-year-old female healthcare worker who had no pre-existing health conditions. How concerned should we be?
It's a little bit concerning. She was a pediatric oncologist, just as myself, and she was a mother of 2 children. And she had a vaccination, and after 48 hours on the New Year's Day, she suddenly passed away. So she didn't complain anything when she had a shot, but to her daughter, she told that there is a normal discomfort. That was a very trivial symptom. And since this RNA vaccine is a very new one, still we have to wait for the autopsy right now. This Pfizer vaccine was on phase 3 trial. There was 2 mortalities also. One was the 3 days after the shot, and the patient suffered atherosclerosis. I mean, she had the patient had underlying disease. And the other mortality happened 60 days after the vaccination, and it wasn't just a cardiac arrest. So still, we can say it's not that dangerous, but the 40-year-old case needs to be approved by the autopsy, and we have to wait for that.
I see. Meanwhile, Dr. Kim, with regard to treatments here on the local front, Korean pharmaceutical company Celltrion has applied for conditional approval for its antibody treatment. How effective is this treatment, and are tests being conducted to check its efficacy on the new strains of the coronavirus?
Well, unfortunately, I don't have the numbers. I mean, in terms of efficacy, but I think they probably measure the efficacy based on the some neutralizing activity of those antibodies against the viruses. So I think maybe neutralizing efficacy should be just probably good enough to advance to the phase 2 or phase 3 clinical trial. But as you said, they actually submitted some conditional approval from the Korean FDA. So I think I'm still also waiting for their data, but they have not shown the data yet. So, but I think it should be good. And then regarding the new variant of the virus, I think this is not the vaccine. So vaccine, we actually, by the vaccination, our immune system actually elicits many antibody responses. But in this case, this is a limited number of antibody that we are actually injecting. So depending on how many antibodies we are actually injecting, for example, there are some prior examples, for example, like from Eli Lilly's and then Regeneron. The companies actually, one company actually injecting only one type of antibody, but the other company actually injecting just the combination of the 2 antibodies. For combination means that if there is some certain variant, some evading some one specific antibody, maybe the other antibody could just recognize and effectively neutralize it. So I think maybe Celltrion maybe just maybe consider these things just in mind already. And then as far as I know, they developed some antibodies, and from some convalescent plasma. And then I think they probably have some diverse array of some antibody candidates, just in case to prepare for this kind of some variant, just a variant the emergencies. So, and then I think in addition to just the Celltrion and other pharmaceutical companies, like the vaccine companies, they probably now under just doing some testing, some efficacy of those antibodies for this new variant.
I see. Meanwhile, Dr. Kim, I understand quite a number of studies are reportedly supporting the use of ivermectin to prevent and treat COVID-19. Please tell us more about this antiparasitic drug and its impact on COVID-19.
Well, actually, the first report of the efficacy of this ivermectin on the COVID-19 was reported about just almost a year ago. And during that time, there was some sort of just a controversy about the potential use of this anti-parasite drug on the patient. But I think this is not completely new, but this is just a part of the some drug repositioning experiment. Drug repositioning means that using some already known, already approved drugs to other indication. So in this case, this is a parasite drugs that the people are trying to use this drug to other indication, in this case, COVID-19. And then while this drug has been known to have some broad spectrum antiviral effect, even before COVID-19. But this result is based on the cell culture experiments, not in some human clinical trial. So in cell culture experiments, we need some clinical trial experiment for this ivermectin as well. And then one of the concerns is that in cell culture experiments, the effective concentration of the ivermectin for the suppressing viral replication, that is really actually attained in our human clinical trials. In the cell culture experiment, we can actually add the concentration of the ivermectin, but in the human system, there is a certain range of immunization of this particular drug. But this condition, this effective condition is really difficult to attain in our human systems.
I see.
Yeah.
Meanwhile, Professor Kim, misinformation about chloroquine, an anti-malaria drug, as a treatment for COVID-19 had quite a number of elderly here in Korea seeking to purchase it. Please do set the record straight for us regarding chloroquine and COVID-19.
There is already, we have a report that chloroquine is not effective for COVID-19. It's a medication for malaria or amoebiasis and some rare types of autoimmune disease, and they should be prescribed from the doctor. It's not something you can just take and buy from the drugstore. And there are also side effects of it, especially heart problems. So it needs a intervention, and I don't know why they behave like that, the people who are taking hydrochloroquine. It's like a drawing man will catch a straw mentality. But since the high-risk group became clear, like patients aged more than 65 and patients with underlying heart problems, lung problems, kidney problems, maybe they are desperate to prevent this kind of a pandemic. I would recommend them to keep on the quarantine measures and self-hygiene, mask wearing and hand washing, everything. That is much more effective than taking some unapproved drugs.
Right. Professor Kang, I'd like to direct your attention back to the vaccine efforts here. Korea is poised to launch its vaccination campaign next month. What are your thoughts on the timing of Korea's vaccination campaign, Professor Kang?
Well, I'm pleased to learn that the government of Korea is planning to vaccinate people starting next month. However, I'm afraid that I could not find the status of the pre-ordering status of the vaccines by government of Korea. For example, in Canada, we have pre-ordered 414 million doses of COVID-19 vaccines from 7 different companies. And now we have ordered almost 10 doses per person in Canada. Whereas when I look at the WHO reports for the pre-order status of Korea, I have not seen any. Maybe I have missed, but I don't know how Korea can attain those vaccines to start the vaccination next month.
I see. Well, hopefully it's on track, though. Professor Kang, I am aware that you are also actively involved in vaccine development. Please tell us a bit about your endeavor to this end.
Yes, there are about 160 or more vaccines being developed around the world. And these about 160 different vaccines fall into 7 different categories. And we are using replication competent vector-based vaccine, and we have the platform technology using a raptovirus as a carrier. And we have developed this platform technology for other vaccine developments. And we have developed the vaccine against COVID-19 as well. And our vaccine shows tremendously high neutralizing antibody induction after vaccination in preclinical trials. So we have completed all the preclinical trials. Now we are going into the manufacturing of this vaccine in GMP facility to do the trials in human. And of course, it'll take some time. Normally, the vaccine development takes about 5 to 10 years in normal circumstances. But because of the urgency of the COVID-19 vaccine, would you believe that this vaccine, Moderna and Pfizer vaccine, now AstraZeneca, Oxford vaccine, has been developed in the last 10 months and is now approved for the vaccination around the world. And there are so many countries have ordered these vaccines. Now we are talking about the efficacy of the vaccines of some 94.5 and 95% efficacies, but the numbers, although they have tried 30,000, 44,000 and so on for the trials, but the numbers of the infected individuals were quite small. And we were talking about 170 infections out of 44,000 people and 22,000 in vaccine arm. And also there is a Moderna vaccine which has recruited 30,000 individuals, but there were only about 90 people positive patients. So when we look at that efficacy statistically, how important that is, we have to see, because we are now studying mass vaccination, and I think the data will come in from now on to see really how effective these vaccines are. Having said that, I think the vaccine development is very important. There are, as I said, 160 and more vaccines being developed. Some of these vaccines will take time to reach actual people. However, we need really effective vaccine to contain this disease and actually prevent this COVID-19 pandemic. So our efforts is there, and we hope that we can develop many vaccines which can have a much higher efficacy or effectiveness without any side effects. So we need safe and effective vaccine to prevent this COVID-19. And also we have to vaccinate about 1/3 of the total population of the world. That means about 2.5 billion people, or over 2.5 billion people, have to be vaccinated in order to induce herd immunity so that virus has no place to go, and so we can prevent this COVID-19 pandemic.
Right. Professor Kim, as a medical professional yourself dealing with patients, what do you believe is important with regard to prevention and treatment efforts?
As Professor Kang mentioned, number one priority, it should be safe and effective. And the delivery should be fair and ethnically correct, and we should have a clear priority, who's going to have the vaccine first. And after all those vaccinations, we still have to look for better vaccines because, for example, seasonal flu vaccine was not developed within a year. It took about 20 to 30 years to have this result of effectiveness around 60–70%. And I want to mention one more thing about the recent RNA vaccines, like from Pfizer or Moderna. It's kind of an interim report, and they evaluated how many patients did actually get COVID-19, but they did not evaluate any possible infection from the vaccine group who could transmit COVID-19 without showing any symptoms. So I think they did that evaluation, like doing the whole antibody test or COVID-19 test for all the participants. We don't have the result yet. So if we have it, then we know that the actual effectiveness of these vaccines. But before that, even patients who got vaccinated, they should keep on being cautious, wearing mask, hand washing, and social distancing. So that's the thing I want to emphasize.
Of course. Dr. Kim, starting next month, if all goes according to plan, we will have access to both vaccines and treatments to fight the pandemic. What implications does this reality have on Korea's COVID-19 containment efforts, do you think?
Well, obviously, this is just a huge progress, just in terms of that we have another line of just tools and weapons and armament just to fight against this COVID-19. But then, as just the Professor Kim said, this, especially for the vaccination, this vaccination induces pretty good just immunity to the actually At this time, what is known about this vaccination is this probably induced the immunity to the diseases, not immunity to the infection. So that has to be actually just demonstrated. And I know some of the U.S. probably in some college settings, some probably I'm not quite sure, but the Moderna is probably just trying to investigate such kind of thing in some certain circumstances, whether this vaccination also actually prevents transmission, in addition to preventing diseases. So this is one thing. So while we waiting for such kind of the investigation result, we have still keep our public. We have to keep the self hygiene and the public measures, including wearing masks, washing hands, and then keeping some physical distance.
Right, as Professor Kim has also emphasized. Professor Kim, given the heated race over vaccines and the challenges associated in trying to secure them, do you believe our best bet then is to develop our own vaccines here in Korea?
We should have our own vaccine. That's true. If I mention about the Spanish flu we had about 100 years ago, it has another name called H1N1. That means became endemic. So every year we have to take care about the flu patients in that flu season. And before this pandemic of COVID-19, as I'm working at the emergency room, there are many patients complaining of the flu symptom, and we should put the patients in a special area, not mix with other patients without fever, without respiratory symptoms. Well, it was very difficult because so many patients coming with same symptom, and we should have to do the flu test, and we have the result in a very short time, which is a rapid test. But that diagnostic tool is not that accurate as the RT-PCR we are doing for COVID-19. So every season, if the season comes, we have to give the flu shot for medical personnel who work in the hospital and the elderly persons. If the COVID-19 becomes endemic, we might have to do both, for the influenza and for this coronavirus. Well, somebody will say that I'm not that optimistic, but there's a high chance that this COVID-19 might become endemic. And we might have to do both tests at that flu season. So that's something we have to think about. So for 2021, what is our short-term plan? As Professor Kang mentioned, we should have enough vaccination to cover our population. That's the short-term number one priority. But for the long term, we should have our own vaccine development, because we don't have the full picture of this recent RNA virus or AstraZeneca or any Oxford. So we should continue our efforts of our own, and soon we will know which one works better, and we'll settle down. And if we have our efforts of our own in Korea, it's very easy to follow up and develop the most efficient vaccine. So I wish that we have our own in the near future. Maybe it's going to take more than maybe a few years, but we should have it.
I see. Dr. Kim, I understand that you're focused more on therapeutics, but in your opinion, what is hindering our efforts to come up with a vaccine? Is it true? The common notion is that we don't have a lot of participants for test trials. What are your thoughts?
The vaccine development?
Yes.
Wow, it's hard to tell. But obviously, the first one is the securing the enough number of participants to clinical trials. But as we saw for some like Moderna and the other clinical trials, that actually number of patients, number of participants in this case like more than 40,000, like 30,000. So we have to. The question is whether we can secure such kind of numbers in Korea only, or we have to explore the certain possibilities in some foreign countries as well. So that might be first the hurdle that we have to actually somehow overcome.
Right.
But other than that, I think development our own vaccine in Korea is very important, because as Professor Kim said, this COVID-19 or other coronavirus disease have a high chance of becoming endemic. So then we have to have our own vaccine anyway.
Right.
whether it can be used at this time for COVID-19 or not, but we have to have our own, and we have to build up our own capacity to deal with this problem.
Right, as Professor Kim said, in a long-term strategy then.
Right.
Professor Kang, how do you assess the vaccination campaigns currently underway in quite a number of countries across the globe, and what are perhaps some of the future tasks that lie ahead in the global fight against COVID-19?
Well, I think we have to have effective, proactive government action to deliver this vaccine to many people, especially those vulnerable people that who has a high rate of the death, and in the long-term care homes, and also the health professionals who care about these COVID-19 patients must be vaccinated. I think we need, as I said before, that we need to have vaccinated about 1/3 of the world population or population of any country to establish herd immunity. So I think that is a priority. And now, which vaccine should be used? We have to see. As Dr. Kim said, that all right, the Moderna vaccine or Pfizer vaccine is mRNA-based vaccine. Maybe it's a vaccine against the disease and not to prevent infection. That is a good point. However, we have to stop infection in order to stop this pandemic. So we need a vaccine which can create strongest neutralizing antibodies which can prevent the infections. And that is a major task. And I think every country who are developing these vaccines are targeting for strong neutralizing antibody production with the vaccines that they develop. So I think that's very important.
Right. Professor Kang, personally, what are your thoughts regarding intentions over in the UK, where authorities have spoken about plans to extend the time period between the first inoculation and the second inoculation from 3 weeks, around 3 weeks that is, to about 12 weeks. What are your thoughts on that?
Well, our immune system, we have to establish so-called memory cells. When we vaccinate with the first vaccine, we are teaching our white blood cells, here is something that you have to fight for, so that our white blood cells have memories. And then we have to wait for about 2 or 3 weeks, and then go in with the same antigen or vaccine, and that can then trigger stronger immune responses. Therefore, the prime and boost vaccination is necessary. So different vaccines have a different waiting period, but normally 2 to 3 weeks is adequate for the prime vaccination to act, and then go into the second vaccine, booster vaccine, to stimulate the immune responses stronger. So I think we have to wait for 2 weeks in order to establish our memory cells, and then we can go in with the second dose or boost immunization, which can then trigger stronger immune responses. Then that will trigger much stronger neutralizing antibodies. In our hand, for example, preclinical trials with our vaccine, and certainly the prime immunization after 2 weeks is not strong enough, but if you go in with the boost immunization after 2 weeks, and 2 weeks after boost immunization, that is about a month later, we have a strongest immune responses and produce the strong and the highest neutralizing antibodies. So it is necessary to teach our body how to stimulate and how to produce the strong neutralizing antibodies. So that's a waiting period is necessary.
I see. All right, Professor Kang over in Canada, thank you very much for joining us at this hour with your thoughts. Professor Kim here in the studio, thank you for being with us. And Dr. Kim, thank you for your insights.
Thank you. Nice to meeting you all.
Right. Well, the third wave here in Korea has led to a tragic milestone with regard to the country's death toll. And tomorrow, we explore ways to better address this sad reality. In the meantime, do take care and thank you for watching.